Hi, good morning, and welcome to, Cop- or I'm sorry, it's not even Coffee with the Coalition. It's our special presentation by the Latino Coalition. It is hosted by the Indiana Coalition to End Sexual Assault and Human Trafficking. My name is Mariah Thatch, and I'm the Marketing and Events Manager here at ICASA HT. Before we get started, I'd like to go over how to participate in this event. Participants may view captioning by clicking on the Captions button at the bottom of your screen or under the More button. Next, click Show Subtitles to view captions at the bottom of your screen. So that we know who is in attendance and can call on anyone who asks questions, please be sure that your first and last name and pronouns are displayed. We use to use the features needed for today's event, please hover over the bottom center of your screen and you will see a series of icon buttons. The mute button can be used to unmute your microphone when you are called upon. All lines have been muted at this time. Please click on the chat button icon to open the text box on the right-hand side of your screen. During the designated Q&A sessions, you may raise your hand or comment in the chat box. To use the raise the hand button, it can be located at the bottom of your screen under the More button. You may submit comments or questions for today's presenters in the chat box at any time during the presentation. Questions entered regarding the presentation may be addressed immediately or during the designated Q&A session. ICASA HT staff will be monitoring the chat box to help relay any questions to the presenters. If you experience any technical issues during this call, please send a message to me in the chat box and I will get to assist you. This session may include triggering content, so please feel empowered to leave the session if you feel uncomfortable in any way. This session will be recorded for your reference. Once the recording is uploaded, we will let attendees know that they can access it through their original registration methods. At this time, I'd like to introduce Tanya Godinez. I'm sorry,
Godinez is okay.
Godinez. I wrote it out phonetically and everything.
You're okay.
A coordinator of sexual violence program at the Indiana Latino Coalition, and Brenda Guzman, a coordinator for domestic violence program at the Indiana Latino Coalition. We are grateful for all the work that you are doing, and we are looking forward to your presentation. So thank you, ladies.
Thank you. Oh, thank you for having us. My name is Tanya Godinez. I work for the Esperanza program at the Latino Coalition Against Domestic and Sexual Violence. I've been working there since 2018, so it's been a whole journey at this organization. The growth that I've had. But yeah, would you like to introduce yourself?
Yeah.
as well?
Should we start the
Oh, yeah.
presentation? Oh, hi. My name is Brenda. I have working at the Latino Coalition Against Domestic and Sexual Violence for the past 6 years. I am the supervisor for my program. I am also a trained medical interpreter. I am my role in the coalition involves many tasks, including assisting with protective orders, leading support group, providing interpretation services for my clients during their family and immigration, a doctor, police reports, and during any appointment that I may have with my clients.
So the name of the presentation for today is called Addressing Service and Language Gaps, Enhancing Inclusive Services for Latino Survivors. And it's presented by us. So for the introduction, the overview is importance of providing inclusive services, focus on Latino survivors. And then the objectives for today's presentation is identifying language and cultural barriers and enhancing service delivery through understanding and inclusivity. So I just want to talk real quick about the Latino population in the United States. So in the US, there's 19.5% Latinos living here. And in Indiana, there is 8.8%. And in Marion County, there's 13.9%. So this is a source from the US Census Bureau. We have grown tremendously. And also just want to mention that percentage of Latinos that live in the US come from 22 Latin countries. So they all speak Spanish, but their terms and slangs are different from each other. So for example, in the US, we call straw, right? In Mexico, they call it popote. And in Honduras, they call it pajilla. So like they have like a different terminology for certain things. Okay, so language barriers, challenges faced by Latino survivors. So their challenges is limited English proficiency. So many Latino survivors may have limited or no English skills, difficulty in understanding and communicating with service providers, miscommunication between survivors and service providers. So language differences can lead to misunderstandings and inaccurate information exchange can occur. An example of an inaccurate information exchange is when clients come to me that they did police reports because of their limited English, the police officers have a hard time understanding them and do not have an accurate report of the abuse. So I had to like accompany clients to the police station to correct the report. It's also important to get an accurate report for eligibility of U visas and proceed with criminal charges against the perpetrator. So that's an issue that I've seen helping Latino clients. Yeah. So consequences of language barriers. So reduce access to support services. Survivors may struggle to navigate and access necessary services, limited understanding of available resources and how to use them, increase of feelings of isolation and misunderstanding. So language barriers can exacerbate feelings of isolation. Survivors may feel misunderstood and disconnected from the support system. Okay, so, all right. So understanding Hispanic culture. So the key cultural concepts is machismo and Marianismo. So machismo is traditional expectations of male behavior, often emphasizing strength and stoicism. And then Marianismo is idealized female virtues such as purity, moral strength, and self-sacrifice. So the impact on survivors, influence on victims' willingness to seek help, and the perception of sexual assault and reporting barriers. So for that, today, many people, especially millennials and Gen Zs, don't strongly follow the traditional values of machismo and Marianismo. However, these values can still be found, especially among other Latin countries. So it really just depends on how they were raised and how much of they still value these traditions. So okay, so identifying service gaps, current issues. So the current issues are that there is a lack of bilingual staff and materials. Many organizations do not have staff fluent in Spanish or other relevant languages. Essential materials and resources are often not available in multiple languages. Insufficient cultural competency training. So service providers may lack training on cultural sensitivities and the unique needs of Latino survivors. This can lead to misunderstanding and inadequate support. So, for example, there are shelters that do not have Spanish interpreters, and their applications are only in English. So we must help the shelters by translating for the clients and filling out application forms. There also has been situations where there are shelters that won't accept our clients because of language barriers. So they ask us if we're available to translate all the time if they have questions, because if not, they will not be able to help the client. So that is one of the issues that we have faced with helping with the Latino community. It's the whole language barriers. So impact of identified service gaps. So ineffective service delivery, language barriers, and cultural insensitivity can hinder effective communication and service provision. Survivors may not receive that support or information they need in a timely manner. Lowered trust and engagement from Latino survivors. So lack of understanding and representation can decrease trust in service providers. Survivors may feel disconnected or reluctant to seek help. So for that, have had cases where clients are in shelters and they do not feel like they're being helped properly by their service provider and communicate with me what's going on. And sometimes I have to like mediate between the client and service provider, so they can kind of like communicate effectively, and that way the client feels more heard pretty much, and that they're getting the services that they need, the resources that they need, and stuff like that. So that's something that I've seen as well, helping Latino clients. Okay, so the strategies for addressing service gaps. So enhancing language access. So we do need to hire more bilingual staff and interpreters, recruit staff fluent in Spanish or other relevant languages, utilize professional interpreters for important communications, provide materials in both English and Spanish, ensuring all information and supporting materials are available in both languages, and regularly update and review translations for accuracy. So the Latino Coalition offers translation services for materials like brochures, posters, intake forms, applications for service providers in different counties all over Indiana, because we believe that that will help the Latino community tremendously. So we do those for free, pretty much.
Okay, so we're gonna talk about enhancing cultural competency. So we have regular training sessions for staff. So we need to implement ongoing training programs focused on cultural sensitivity, include practical scenarios and role playing to build understanding, understand cultural nouns and behaviors, educate staff on cultural differences and the specific needs of Latino survivors, fostering an environment of inclusivity and respect by recognizing and addressing cultural norms and expectations. So what we do is that we provide cultural and linguistic competency trainings for service providers across Indiana. So our training, we train service providers in Spanish language and Hispanic culture. So if any of you are interested in being trained in Spanish, you just have to email us so you can be trained in Hispanic culture and Hispanic Spanish language. So it says cultural norms with Latino sexual assault survivors, family and community influence. So our Hispanic community has a strong emphasis on community and support networks. We need survivors may feel pressure to protect family honor and avoid bringing shame. So many of our clients don't report sexual assault because they don't want to bring shame to their family. Gender roles and expectations. Traditional gender roles may impact how survivors perceive and report their experiences. Cultural norms may influence attitudes towards seeking help and discussing sexual assault. Stigma and privacy. There's a stigma surrounding sexual violence, and this can lead to reluctant and disclosing experiences. High value placed on privacy and personal dignity may affect willingness to share details. Trust and respect. Build trust is crucial for survivors so they can feel um so they can share with their ¿cómo se llama? I'm sorry.
It's about like building trust and
Yeah, so
so survivors may be wary of outsiders. And then demonstrating respect and understanding of cultural values fosters a safer environment for survivors.
okay, so for example, we have clients who come to us whenever they suffer from sexual assault, and they come to our office and they explain their story to us. They explain what happened to them, and they explain if it happened to their children as well. But whenever we talk to them, they're not willing to report it to the police. They usually tell us the whole story, but they're not willing to report their incident to the police.
Yeah. Or sometimes they tell us the story and they are willing to talk to the police, but they don't tell the full story to the police. So like the report isn't accurate, you know. So that's another issue that we also face with trying to get this report, you know, from them.
Okay, so improve communication and trust. Clear interaction, addressing barriers helps survivors and providers to communicate more effectively, leading to a better understanding of needs and concerns. We need to build stronger relationships, building trust throughout effective communication, foster more reliable and supportive interaction, encouraging survivors to engage with services. Broader access, overviewing language and cultural barriers makes services more accessible to a wider range of individuals, including those who might otherwise be excluded. Tailor services. Services become more effectively when they are adapted to meet the specific needs of diverse populations, resulting in better outcomes for survivors. Cultural sensitivity counseling approach. Tailor counseling methods. Implement counseling techniques that respect and integrate cultural values and beliefs. This includes understanding cultural perceptions of trauma and healing. Cultural competency training. We need to ensure counselors receive trainings in cultural awareness to effectively address the unique needs of Latino survivors. Local partnerships collaborate with community organizations and leaders to reach survivors and build trust within the community. We need to develop outreach programs and materials that are culturally relevant and accessible in bilingual resources and community events. In many cases, if our clients are from other countries, like for example, if a client is from Mexico, we refer them to the Mexican consulate because they have resources for them. So if a client needs an immigration attorney, a family attorney, but they don't have any money, the Mexican consulate can pay for their attorneys. So, but you have to be mindful of our clients are from different countries and not everybody's from Mexico. So you have to ask the client where is he from or where is she from, because there's 22 different Latin countries and everybody is not from Mexico. So you gotta make sure you know where your client is from before referring them to any services. Okay, so this is a case study example from one of our clients. We took her to Eskenazi Health Center of Hope. So in Eskenazi's Health Center of Hope, they effectively tackle language and cultural barriers in healthcare by providing tailored language services and ensuring a culturally sensitive environment for clients and their families. So whenever we took our client to Eskenazi, the first thing they did, the nurse used an electronic device to request a Spanish interpreter in real time during the consultation. So our client was able to talk to the nurse in her language, and she felt comfortable by doing that. They also created a safe environment for the client. So the client took her 8-year-old daughter and her 6-year-old son with her to the appointment. So we stay outside the room with the children. So the children were not present during the mother's physical exam, so we could ensure they were feeling comfortable and it could reduce trauma. Okay. So the client was moved to a separate room for the forensic evidence exam, and then we ensured that she felt like she had some like comfortable. After the forensic evidence exam, the nurse called the police to report the incident because she knew that the client didn't report the incident, so the nurse helped us report the incident to the police. So they help us ensure the client and the children felt safe. The measures taken to ensure both the client and her children felt safe and secure throughout the process. Effective communication with the authorities. So the police who came to the emergency room, they translated her case in Spanish to ensure that she was informed and she understood every step of the report. The police made the client feel heard. They explained that a warrant had been issued for the perpetrator's arrest and they would be looking for him. The outcomes that we achieved is that the client felt safe and comfortable. The client and her children felt safe and comfortable, which is crucial for in a sensitive healthcare situation. Effective communication. They use a Spanish-speaking provider and interpreter to eliminate language barriers to ensure clear and effective communication. Dignified and respect care. The forensic evidence collection was conducted by utmost respect for the client's privacy, upholding her dignity. The law enforcement support. The collaboration with the police ensured that the client felt supported and informed about the legal steps being taken. So she was very happy after everybody was able to help her in Spanish because that is her language, and she wasn't afraid because before we went to the hospital, she was scared to go to the hospital because she only speaks Spanish, but we explained to her that they were going to be able to help her. So community collaboration, building partnerships. So this is, we usually work with many organizations such as Indiana Legal Aid, Indiana Legal Services. We work with many organizations, and whenever we call the organizations, we ensure that we are there with the client. So we are there, we interpret for the client to make the appointments. And during each appointment, we interpret. So for example, if a client is going to apply for like child custody, so we go to Indiana Legal Aid with the client and then we interpret for them during each session to make sure that they're comfortable. So one of the things that we notice that we need to do is to establish relationships. So partner with local Latino organizations or with organizations in general to be able to help our clients better. We need to engage with leaders, work with community leaders to gain trust and promote service awareness among Latino communities. We need to engage in our community events and awareness programs. We need to participate in events, join local cultural and community events to connect directly with the community. We need to host awareness programs, organize and support programs that raise awareness about available services and educate on relevant issues.
So for advocacy and outreach, we promote services in Latino communities, targeted marketing, use cultural relevant advertising and communication strategies to inform Latino communities about available services, accessible information, ensure service information is available in Spanish and other relevant languages and through channels popular within the community. And then foster a supportive network for survivors, building support networks, create a joint support network that connect survivors with resources and peer support, and then encourage peer support, develop programs that facilitate connections among survivors to share experiences and support each other. So moving forward, the next steps, develop a comprehensive action plan. So setting clear goals, outline specific objectives for enhancing services and addressing identified gaps, assign responsibilities, designate roles and responsibilities for implementing the plan and tracking progress. Timeline and milestones, create a timeline with key milestones to monitor progress and adjust strategies as needed, and continuously evaluate and improve services. So regular assessments, like implement ongoing evaluations of service effectiveness and community feedback, and then adapt and update, use evaluation results to make the necessary adjustments and improvements to services. And yeah, should I put, we're done with the presentation. Here's if you guys have any questions, we'll be glad to like answer.
In the chat.
Oh, in the chat. Okay. Oh, I just saw this.
Do you want me to read them to you? I can.
Yeah, please.
Yeah. This is from Claire Clemens. It says, "Hi, Brenda and Tanya. Very interested in receiving a cultural competency training for me and my staff. Will you be providing your emails?" Oh, yes, of course. Sorry, I didn't even read this. Yeah, I think a lot of people would be interested in those trainings. If you could possibly provide like anything else, like if you have any reference materials, I think that would be really beneficial for these communities. And then there was another question. It is there anything you believe law enforcement can do to encourage complete reporting?
I think maybe talking or like having like webinars with them. I mean, what we do is like we have a program for English for Latinos where they have like materials for police officers to kind of teach them a little bit of Spanish as well. But that that's the only thing I can think of, like educate them and also kind of encourage them to get, if they're not able to understand the victim, get someone to translate for them through the phone. Just because I've seen clients always say that like it could be domestic or sexual violence where they listen to the perpetrator because they know English, so they go based on what the perpetrator says and they try to sound like they're the victims, and then the actual victim is the one that practically can say gets screwed over pretty much, because she doesn't know the language, and instead of the police officer calling a translator or interpreter to kind of understand what her version is or her side, they don't do that. So they don't do that extra step sometimes, and that kind of obviously that affects them a lot too. So I think honestly encouraging them to get an interpreter on the line would honestly help the accuracy of the report.
I have a question.
Pretty much.
So first of all, thank you for all of this information. This has been really helpful information. And I know because ICASA and the Latino Coalition have interacted a couple of times that you guys have a wealth of services for community-based advocates across the state who might want to learn more about your agency and where they can learn about the services you can provide, or to understand better the places where it would be appropriate to reach out to your agency to try to partner in support of a client, or how to make a referral to you if that's the right thing. I'm thinking really specifically, we have crisis centers and sexual assault response programs across the state, some of which have pretty small staff. And in places where maybe they don't have staff with Spanish language capacity, or where their staff isn't able to meet all the needs or wants to understand some more resources, if they want to learn about your agency or they want to partner with you, where should they be looking and how should they be trying to connect with your team?
Oh, so we misspelled the email, but my director, Edwin Arellano, he would be the perfect person to contact. I just spelled it better, or we just spelled it. It's earellano@indianalaTinoCoalition.org. If you guys are interested in like partnering with us, or if other organizations or agency want to know more about our services, he would be the one to communicate with. And also he's the one that does the cultural and linguistic competence trainings. So he does teach a lot of service providers like Spanish and like our culture and stuff like that. So if you guys are interested in that, or if any other organizations interested in that, he would be the one to contact with. So yeah.
Thank you.
Of course. Thank you.
And for referrals for sexual assault, they can email Tanya, and for referrals for domestic violence, they can email me. And our emails are right there.
Okay, one more question.
Yeah.
Because I know that geographically you are also located in Indianapolis, like we are. What kinds of services are folks able to engage with virtually through your organization? I'm thinking if they live in the far northwest corner, are there still services that they can tap into, or are most things in person?
No, we offer free English classes, virtually, computer classes, technology classes. Everything is in person and online. So if they want to participate online, they're welcome to participate online.
Also, our support group, we have it in virtually. So if you guys know anyone that has suffered from domestic or sexual violence that is interested in a Spanish speaking support group, we offer that as well. And what else? Also, like for example, I've had a client that she lived outside of Marion County, like pretty far away. And then she was at a shelter, and DCS was involved, all this stuff. And DCS asked me if I could be in the virtual meeting to kind of have that support as well, and in a way, like kind of see like her progress and in her case and stuff like that. So stuff like that, that's one thing I'm grateful for like technology, because we're able to connect like that, even when it's like far away. We're still able to help some way. So yeah.
Thank you. I really appreciate that, especially knowing about the virtual support group that runs in Spanish. There are very few support groups in Spanish across the state. And so knowing where there are virtual groups that people can join in remotely is always helpful. So thank you for sharing that.
Yeah, of course, of course.
Thanks, Brenda and Anya, for joining us today. I have a question around hiring bilingual folks, right? Because that's a super important thing that you said, organizations can do, is to hire someone that can help translate. I personally think that it's important to compensate those folks, because that's a skill, right? Like any other skill that they have. You shouldn't just hire someone who can speak Spanish and then give them all the Spanish stuff to do just because they can speak Spanish. So that doesn't seem very fair. What kind of resources are out there for folks to know how much compensation is fair for someone who you're hiring, to do some services, but then also have some translation services? Do you have any ideas about like compensation rates or anything like that for that? And then also, because a lot of our service providers in the state of Indiana are just strapped for cash all the time, do you know of any specific grant opportunities or funding opportunities that help fund hiring of bilingual folks, or anything in that area to help, offset some of the cost of being able to have someone bilingual on staff?
That's a good question, but I think that because we're like all like all bilingual staff, I don't think we know of that. Because like I guess for like here, like we're all like bilingual, so I don't really know about any grants or places. I don't know if you do. You know any place?
Surplus zone.
Yeah, I mean the only place that I like we kind of like know where they kind of get have like what's it called, like trans interpreters that are like certified is like Luna's translation services. And there's other ones, but I don't know the names for those. But specifically Luna, they have a lot of like people that are bilingual and they're just trying to get certified and stuff like that. They have like medical, but I'm not sure if they have legal or
No, they just have medical.
just medical.
Yeah.
Okay. So, and they also do like they actually translate documents too. But other than that, like I don't really know a specific foundation or a place where you can do like grants to get grants for bilingual service, like bilingual staff. I'm so sorry.
Sure. No, that's fine. Thank you very much.
Mhm.
Oops, sorry, my computer's. Okay. Oh, look, there's another thing in the chat. It says Clues Fund supports immigration service or specific services. While not specifically Hispanic focused, they have supported us in funding a bilingual advocate. And I think Claire Clements, can you remind us what organization you work for?
Yes, sorry, I couldn't get off. The Center for Victim and Human Rights. So we're a legal services provider.
Thank you
Thanks.
for that.
Yeah.
I'm not sure how to say your name, Care. Thank you for
Yes.
that
Yeah.
information. Yeah,
No
Clues. I
problem.
forgot about Clues Fund. That's really great. Thank you.
Mhm.
Okay. Well, I thank you ladies for your time today. And if anybody needs to reach out, please use the email addresses on this last slide. This will be recorded and it is recorded. And we will be putting this online so you'll be able to access this training after the fact and also be able to reference these slides in the future if you need them. I just again want to thank you too for your time and all the work that you do. We're really appreciative of being able to collaborate with you all. So yes, if there's any more questions, you can send them to both Tanya and Brenda through their email. And I just want to say have a great day, guys.